Now it is Pink October, a month dedicated to raising awareness and promoting breast cancer screening. Each year here in France, 61,000 people are diagnosed with breast cancer, and it claims over 12,000 lives in the country each year. And it's not just here in France. Around the world, cancer accounts for something like 1 in 8 cancer diagnoses. And despite efforts to raise awareness, many women say they still don't fully know the risk factors. To discuss, our science editor Julia Seeger with me now. And Julia, so that stat I just referred to comes from a study here in France by the Cancer League. It says that more than 50% of women here don't fully know the risk factors for breast cancer.
Exactly. Despite years of awareness campaigns, 53%. So that's more than one woman out of two says she doesn't know enough about breast cancer, and she can't cite the risk factors. Now, at the top of the list of the risk factors, of course, is age, because you have 80% of breast cancers that occur in women that are 50 years old or above, but you still have 40% also. 10%, that are diagnosed under the age of 40. And the second risk factor is sex, because 99% of breast cancer occur in women, but you still have 1% that do occur in men. And then, of course, you have family history, genetics, but also lifestyle and smoking and alcohol being the top two, I'd say, aggravating factors, and, of course, the lack of physical activity. But what's important is that we need women to understand better the disease, because we know that that's what's going to push them to get regular screenings. And regular screenings is what actually saves lives. You have 9 breast cancers out of 10 that can be cured if they're diagnosed at an early stage. So this is why we try to encourage as much as we can women to get regular checkups. Now, we know because of studies here in France that women don't get diagnosed, one, because of a lack of information, but also because there's this fear of being diagnosed.
There is, though, some good news, I understand, on the medical front.
That's right. And I think we need to say that to women, that on the medical front, we've never seen so many treatment arise as we're seeing now. So it's an exciting moment, scientifically speaking. So we still heavily rely on what we call the traditional therapies, so surgery, radiotherapy, and chemotherapy. But with radiotherapy and chemotherapy, you still have a lot of side effects. It damages healthy tissues. And also, you never know if the patient has gotten the right amount at the right place. So this is why scientists are developing what we call targeted therapies. And here we've all heard, for instance, of immunotherapy, targeted radiotherapy, or nuclear medicine. So if we refer to immunotherapy, we've all heard about it. It won the medicine Nobel Prize in 2018. And here you're going to try to reactivate the immune system of the patient. So we're going to collect, for instance, the T cells of the patient. We're going to harvest them and teach them to identify the cancerous cells and destroy them. Because the problem is with cancer, when cancerous cells start multiplying in your body, we don't know why, but they go undetected to the immune system at first. So we're going to teach the immune system to battle the cancerous cell. Then, of course, there's targeted radiotherapy, which is absolutely amazing too, because here you're going to directly inject nanoparticles inside of the tumor. And when the patient is going to undergo a regular radiotherapy session, it's simply going to amplify the power of X-rays within the cancerous cell. And so but it's still an external type of radiotherapy, because you're still beaming X-rays on the patient.
And the last type of targeted therapy you want to talk to us about is so-called nuclear medicine. Tell us about that. I mean, quite a phrase.
It is indeed. And when you start reading up on it, you really enter almost a parallel world. That's how much the advancements are breathtaking. But simply put, nuclear therapy is the use of radioactivity for medical purposes. So radioactivity is something that exists in nature. It's a natural, you have elements in nature that emit radiations at very low dosage, of course, but we're going to use that radioactivity to make new types of medicine, what we call radiopharmaceuticals. The way we do it, we're going to use a radioactive isotope, and we're going to embed it in a molecule that's going to serve as a vehicle and bring it inside the cell. Of course, we're going to use a molecule that can easily bind with that cell. And once the radioactive isotope is inside the cell, it emits, of course, an ionizing radiation, and it destroys the cell. Now, what's really amazing is that this drug is injected into the body in a systemic way, so it goes through the bloodstream, and it's capable of this drug of identifying other places in your body where you have metastasis, other types of tumor. And then when you scan the body of the patient, if you've actually linked it to what we call a marker, you can then map what the disease looks like and see everywhere where there are other metastases and whether or not the drug works. if it's reducing the tumors or not. So what's extraordinary with nuclear medicine is that it's a therapeutic solution, but it's also a diagnostic tool. Here in France, it's being tested on the triple negative breast cancer, which is the most aggressive form of breast cancer. And we hope that soon we're going to be able to use it for all other types of breast cancer.
Julia Seeger talking to us there as we mark the start of Pink October. Thanks very much indeed.
Thank you.